everyone. Welcome. We're glad you're here and decided to spend an hour of your evening on this lovely evening, a lovely spring evening with us tonight. You are at what are SSI and SSDI with DAC, more than just a bunch of letters. This is the third in a series of 5 webinars on financial planning and public benefits. The last 2 are on 4/24 and 4/30. I will put the link to the spring calendar into the chat as well. I am Alyssa DeFilippo. I'm the program manager for Connections California, which is a statewide online resource and information hub for people with families with people with any kind of disability. And we have live events and an e-learning library and web pages full of resources. I'll also put that in the chat. So if you're new to this, you can check it out. So this evening, I'd like to welcome our presenters. They're from Special Needs Planning Group in Santa Clara. Ken Prodger is a financial advisor who specializes in helping families plan for the future, including special needs trusts, life care planning, letters of intent, and how to obtain and preserve government benefits. Ken understands that parents of children with special needs often feel overwhelmed with therapies, IEPs, countless other issues, leaving little time and energy to address financial concerns. And Ken knows this firsthand because he has a son with special needs. And Ken was also the past board chair of Parents Helping Parents. So we thank you for serving, Ken. And Scott Gill is a seasoned financial advisor with a passion for building long-lasting relationships with his clients. He specializes in providing financial planning services to families with special needs, helping them achieve their financial goals. He's a member of the Financial Services Institute and brings a wealth of knowledge and experience to his clients. So I'm going to stop my share and turn it over to Scott. Thanks for being here.
Great. Thank you, Alyssa. Okay, let me pull up our screen here. Share and Ken, can you see it okay?
Yep, I'm good to go.
Okay, perfect.
Okay, so if you've attended the first couple presentations, you notice this slide looks familiar. So it basically, we just talk about how it's a labyrinth to navigate this maze of special needs planning. So it's not only, navigating this whole maze, but making the correct decisions on what to do, and then also to avoid some of the pitfalls that can negatively affect a child or adult child with a disability. Some of those pitfalls we're going to talk about today deal with SSI, SSDI, some of those things to make sure that we apply correctly, that we get the government benefits, whether they're needs-based government benefits, or if they're an entitlement benefit, meaning that it's an earned benefit, either from the child or from the parental record. So both Scott and I, with the Special Needs Planning Group, we're both certified financial planners, meaning that this is what we do. There's a lot of people that call themselves financial planners, make sure that they are a certified financial planner. Scott and I are also both special needs consultants. So we've taken additional coursework to address the particular and unique issues that families with special needs children have and that they must face. This is our business. So, we talk a lot about, we're not just advisors that occasionally come across working with families with special needs. This is our mainstay of our business. Well over 80% of my clients are special needs families. We're also accredited investment fiduciaries, as Alyssa said, was on the board at PHP for a number of years. Also the Academy of Special Needs Planners, which is important. So we have clients all throughout the state. Now we have great relationships with attorneys that are up in here. But even if you're in San Diego or LA or Southern California, we know of attorneys. There's a great association throughout the state of California and across the whole United States. So there's certainly times that we've had clients that have moved to different states and we're able to continue their support once they move. This slide is another duplicate. We talk about all the different things that we have to work with, and it's a puzzle. But the puzzle pieces don't fit together very nicely. Sometimes there's gaps. So we've talked about some of the things of special needs trusts and life care plans. So now we're going to talk about SSI and SSDI. So it's important to know what the differences are, how they're different. Unfortunately, they're so close in terms of the lettering that sometimes we get them confused when people are talking SSI, but they're really meaning to discuss SSDI and vice versa. So we'll try and be careful. Sometimes we make mistakes too. But SSI is what's called a needs-based government benefit, and SSDI is an earned benefit. So when we talk about what's an earned benefit, versus a needs-based means that it's means tested, meaning that it's going to talk about assets and income in order to get qualified. And then entitlement means that you've earned the right. So you've contributed to the system, or your parents have contributed to the system, and that's an earned public benefit. So that's the big difference. When it's in means tested benefits, SSI, Supplemental Security Income, and that means that you go to Medicaid, or in California, we call it Medi-Cal. Again, that's for low income people. SSDI is an earned benefit, and the healthcare coverage of that is Medicare. And so I'm going to cover SSI, and then Scott will cover SSDI. So first of all, SSI and SSDI, these are huge topics. We commonly do a full presentation just on one or the other. So we're really going to, rapid fire through some of the stuff of SSI and SSDI. So we're skimming the surface. We're going to be talking at a fairly high level. We do have some time at the end of the presentation to be able to address different questions. And we have come up with FAQs at the end of just through our experience, what parents often ask about these different programs. So just be aware, we're skimming the surface on this, and these can be very complicated topics. So beginning with SSI, it's all about resources. And so resources, remember, this is needs-based. So the important thing is, what don't they count in terms of, of what is resources and income? So first of all, your primary residence is always excluded. The house and the land, your own personal effects. We get into things of, if you have a burial plot, if you have some minimal life insurance, cash value life insurance, it's under $1,500 or less. You can have a car. The one that we come across quite a bit is retroactive SSI or Social Security benefits. So as probably some of you know, you can apply for these government programs, and it's not like you apply and then they approve you right then and there, and then you get a nice check the next week. It can take 6 months, it can take 9 months, it can take a long time to get some of these things approved. Sometimes you have to go through the appeal process, but sometimes when that happens, you then get qualified, and then they do a retroactive check for those months that you should have been receiving the benefits. Well, for some people, they go, well, that check is well over $2,000. It can be many thousands of dollars. What do we do with that? Are we now, when we deposit that check, are we now violating the resource limit? Because now we have over $2,000. In a quick answer, no. So the government gives you 9 months to be able to spend those funds down. So sometimes it's a question that there's too much funds. They don't have the maybe the bills or whatever to pay all those down. So what we could do, it's a great source of saying, okay, here's a ABLE account. We can put some funds over into an ABLE account. We can do several different things with those additional resources. But certainly with the advantage of the ABLE account, that's a great way to transfer some of those funds out of the primary account holder's account, so that we can get below that 2,000. But we've got 9 months to do it, so it's not something we have to do right away. So that's resources. Now we talk about income. So SSI, the Social Security, they break down in earned income versus unearned income. Again, for most of the thing, it's going to be considered an issue as deemed income. So when a child under 18 applies for SSI, it's going to be talking about the income of the family, deemed income, your parents. So many times a child may not qualify for SSI, but once they turn 18, they may now qualify for SSI because now the family income is not deemed to the child. So the adult child, after they turn 18, now it's based on their income and not the family income. A big change was in terms of in-kind income. So, and we'll talk about that or whatever, but if you're providing support and room or and shelter or whatever for your adult child, you may get dinged in terms of what the in-kind support. Now, they just changed the Social Security laws, SSI. It just was passed. So food is no longer counted as in-kind income. So many times we had to do rental agreements and show that part of as being a representative payee that you were paying for some of the food for the child and stuff for the adult child. You no longer food is now eliminated from that, which makes it a lot easier for parents to be able to do the accounting and for people to more easily qualify for the full SSI payments. Okay, so SSI, the state supplement program, the benefit, that's the SSP. So it's broken down into two different parts, SSI. So you have the federal benefit, which is throughout all 50 states, which is $943. So that's what the federal portion of SSI is. California adds $239.94 as a state supplemental payment. Some states have the supplemental payment, some states do not. So that's something certainly to check on if you're thinking of leaving California and moving to some other state. Find out, do they have supplemental payments? I believe California is one of the highest ones, but some Massachusetts and things like that have great supplement payments as well. So if you're getting SSI for your child and it's below $1,182.94, that means you're getting some sort of, they're dinging you for in-kind support. So here's the breakdown of it in the chart. This is right from the Social Security website of the $1,100.92, $1,182.94, excuse me, of what that independent living status would be. So if you're getting dinged from that, then you're probably your payment is being reduced because you're providing what they call in-kind support. So the in-kind support and maintenance, and we're going to go through this very quickly, but basically if you're paying the rent for your adult child, then they're going to do a 1/3 reduction of the federal benefit rate. So if that 1/3 reduction is going to be a little over $300 that you're not going to get out of the checks, so that check is reduced by a little over $300. The California supplement is not reduced, it's just the federal benefit. But for most people, this comes into play when the adult child is living in the home of the parents. So without a rental agreement or anything, then the Social Security is going to say you are providing that in-kind support via the shelter. And so they're going to reduce that by $314. There's ways to get around that where the child technically pays rent. We can come up with ways to be able to do that so that you get back that $300 and something per month. And generally what we recommend, if you get that additional thing, then that's something you can put into, let's say, an ABLE account to start, putting some funds away for the child when you're gone. Next one is a little bit different. It's the presumed maximum value rule, which basically it's another way of calculating that third. Again, examples of deductions, you can see that I've crossed food out because that's no longer the case. But remember, these rules were written many, many years ago. So they listed the things that would be considered in-kind support. If you're paying the property taxes, the rent, the water, sewage, garbage, gas, electricity. Things that they didn't put in there because they weren't really around when the law was written was cable TV, cell phone, some of those things. So these are some things that if you're helping your adult child in in some sort of living situation, you know, don't pay the PG&E bill, pay the cable TV bill. Cable TV does not considered in-kind support, where if you pay the PG&E bill or the utilities, it is considered in-kind support. So this shows you how it would work. So if somebody lives alone in an apartment and paying their rent, however, the parents pay for some of the things. The parents pay for PG&E, which is the utilities, cable and garbage. So what the federal benefit comes in at $943. If the PG&E bill is $90 and the parents are paying for that, then that's going to be considered in-kind support, and they're going to reduce it by $90. However, the parents are also paying cable, but since cable is not one of the things that's considered in-kind support, you can go ahead and pay for that and you're not going to get dinged for it. If you paid the $20 for the garbage, again, you're going to get dinged. So your total payment is going to be reduced by that $90 and that $20. So now the child only gets $1,072 as opposed to $1,100 and something. Okay, a couple big things to remember. Renting an affordable home, let's say if you have, you're able to get Section 8 housing or, you know, affordable housing in different communities where they give you a break on the rent, that's not considered in-kind support and maintenance. And the other example is if you guarantee a child's lease through an apartment, again, that alone does not create the in-kind support. Now, if you eventually have to pay it or you have to guarantee it, then that could reduce it. But if you just, you know, many times where somebody doesn't have a high income and they're disabled, the renter may say, okay, I want the parents to co-sign on this rental agreement. You can do that. That doesn't create any problems. If you have to pay for it, then that does create some issues. Okay, some pitfalls and stuff that we come across when people with SSI. Remember that if you are a representative payee, make sure you have a separate account. You do not want to be intermixing the different funds with your personal funds versus the child's funds. And remember, it's their money, so you have to be able to account for it. You may get audited by SSI, whatever, and they're going to say, okay, we've been paying you $1,100 and something a month. Show us what you've been spending the money on. Right. So they're looking at that saying that's the child's money. And you can't say, well, gee, we went on a big vacation. No, that's not an appropriate use of the funds. You have to spend those funds for the benefit of the child. You want to avoid ATM or prepaid credit cards. Again, that's going to be considered cash, and that's going to be considered in-kind support. You know, reimbursing expenses. It's much better if the child itself themselves pay the actual expenses as opposed to you paying it and then taking the money out of the representative payee account. Don't forget about the resource limitations that we have. You know, with Amazon and some of these other online sales, it's much easier for you to use e-commerce for purchasing things. You know, and again, if it's associated stuff, you can go ahead and pay for it. It can get shipped directly to the child, and you're not dinging them in terms of in-kind support. Be careful what you're paying for, especially if they're living out of the house. Again, pay for the cell phone, let the child pay for the PG&E bill. We also want to make sure that we utilize people and agents that know what they're talking about, and you're always going to have to be an advocate. So one of the things with special needs planning as parents, it's not only knowing what to do and how to do and stuff, getting help from people that are experts in that field, and realize you've got to be an advocate. You've got to be on top of this stuff all the time. And then finally, don't forget about who's going to pay these costs once you're gone. So that's how we determine some of the things of how much do we need to fund the special needs trust? What do we need to do with that? And so what Scott and I do many times is come up with those expenses that you may be paying out of pocket while you're alive, and then forecasting what that will mean once you pass away for your child's lifetime. What does that mean in terms of how do you fund a special needs trust, and how much you're going to have to fund the special needs trust with to pay for those different expenses. Okay, so now so we briefly talked about SSI, so now I'm going to turn it over to Scott to be able to talk about SSDI.
All right, Perfect. Thank you, Ken. And yeah, as Ken mentioned before, there are these two silos that we're exploring right now. Obviously, Ken just went through the means tested benefits, but now we're going to dive a little bit into the entitlement public benefits. Okay. And again, the entitlement public benefits most commonly seen, SSDI, Social Security Disability, and Medicare. Okay. So we're going to spend the majority of the time talking this. There will be a piece where we will briefly tap onto how Medicare will fit into the SSDI puzzle as well. So let's take a step back, okay? Because SSDI, what is it actually a part of? Some of you may or may not have heard of the acronym OASDI. Well, what is it? Okay, well, what it stands for is old age, retirement, survivors, a loved one has passed, and disability insurance. Okay, so the Social Security Trust Fund pays out in these three primary silos. Okay, so we most commonly hear about the silo that's over here. I've been working for a number of years, possibly decades. A percentage of my income is withheld and it goes into the Social Security Trust Fund. And later on, at a presumed retirement age, I get to collect that for the rest of my life, right? Whether it's 62, whether your full retirement age is 66 or 67, or whether you wait for a delayed benefit age 70. What we tend to forget or may not know, though, is that Social Security is accessible at different points of time, depending upon your family circumstances. So if a loved one does pass away prematurely, okay, Social Security can actually pay out income to a surviving spouse, especially if that surviving spouse is caring for minors in the household, okay? Conversely, Social Security has this disability insurance benefit, okay? So part of the money that we have withheld from our paycheck will actually provide a disability insurance payment if we do get seriously sick or injured prior to that full retirement age. So we're going to explore more about what that means, what it looks like, how you become eligible, and then how your loved one, your child, can also participate within this program as well. Okay, so what does it do? It provides monthly benefits to qualified retired and disabled workers and their dependents and to survivors of insured workers. Okay, so let's look at the definition. So how does Social Security define a disability? Well, there's two main definitions that we need to understand. If we look at the first is disability for an adult, okay? And this is defined as an inability to engage in any substantial, gainful activity, SGA. You may see that acronym on different types of literature. And this is due to medically determined physical or mental impairment, combination of impairments that has lasted or can be expected to last for at least 12 months or result in death. So said another way, we have a combination of physical or mental impairments. It's going to last for longer than a year, so it's nothing short term, but also you're unable to work in any capacity, okay? So what's a disability for a minor? Well, a disability for a minor essentially is the same thing, except that inability to engage in any substantial gainful activity. And what we're going to find when we explore the DAC, right, disabled adult child, is how that comes into play, right? How does that come into play for our child that may be transitioning from a minor to an adult before age 22, and then what happens age 22 and beyond? Okay, so as we take that next step, let's dive a little bit deeper into this definition. Okay, so one of the pieces that we have highlighted here is that no benefits are payable for partial disability or for short-term disability. Okay, so where might we see some of those payments come from otherwise? Well, here in the state of California, we do have forms of disability that can kick in and pay for up to 52 weeks. At many employers, we may have benefits through our employer package that can help pay for some shorter term disability before a long-term disability policy might kick in to enhance and or supplement something from Social Security. But at the end of the day, this is about total disability, not a partial. Okay, so again, those 3 bullet points that we need to remember, right? When this is the definition directly from the Social Security's website, right? We consider you to have a qualifying disability under our rules if all of the following are true. You cannot do work at the substantial gainful activity level because of your medical condition. Okay, you cannot do work you did previously or adjust to other work because of your medical condition, and your condition has lasted or is expected to last at least 1 year. So one example that we commonly share is, well, what about the individual? Maybe they're highly educated, right? Let's use the example of an orthopedic surgeon, right? Someone who performs operations on a day-to-day basis. God forbid they get hurt, they injure one of their hands that they use every single day as they're performing their procedures. Although they may be unable to perform what their day-to-day tasks have been, would they qualify under all 3 of these criteria? Perhaps not, because although their hand may have been injured and they're unable to perform their surgeries up to the status of which they once were, based upon their education, would they perhaps be able to go and teach other students that are looking to get into that profession instead? One might say yes. Okay, and so as we go through and we evaluate, am I or am I not disabled, what you have to understand is this is a strict definition of disability. And again, these words, this is a strict definition, come directly from the Social Security's website, right? The rules assume that working families have access to other resources to provide support during periods of short-term disability. This includes workers' comp, insurance, savings, and investments. So where do we see this? Where do Ken and I see this come up in practice? Well, oftentimes as we're evaluating people's financial household, a discussion must take place of what if something happens? How do we access additional resources until a benefit such as SSDI or a benefit perhaps through an employer might kick in to pay a portion of our income, right? We're trying to replace that income, okay? So just remember, very strict definition in terms of being eligible. It's not just I can't do my job, right? What I have been doing, what my education has allowed me to achieve up to this point, it's can you do anything? That's one of the big determinants that we have to be facing. So this is a bit of a summation that we have. So your eligibility, what are the 2 tests? First and foremost, we need to meet that definition of disability, and this is the same as it is for SSI. Now, secondly, we have to figure out, okay, well, have I worked enough, right? Have I met this time frame, right? Have I met this earnings requirement? So in 2024, what you're going to see here is in order to earn 1 credit, okay, 1 credit that goes toward, right, that goes toward the piggy bank of becoming eligible for this entitlement benefit, that means you have to earn $1,730 in wages or self-employed income. Okay, now this is per quarter. Okay, this is not per month. This is not per week. So let's just make numbers easy and let's just say $500 thereabout per month will get you roughly to this number of $1,700, right? Although it's not exact. Okay, so if you have earned more than $6,920, okay, for the year, you've earned your 4 credits for the year. Okay, so that's the threshold that we're looking at. So say, for example, we have a child and our child works part-time at Trader Joe's, and say at Trader Joe's, they're making $300, $400 a month. Technically, over the course of the quarter, that would be less than this $1,730 threshold. So they're actually not collecting credits as it pertains to their own entitlement when it comes to Social Security benefits, and in particular, SSDI. Okay, so one of the things that Ken was just talking about as it pertains to resource testing, well, with SSDI being an entitlement, being something you pay into, well, there aren't any resource tests that they're looking at, right? They're not looking to see, hey, is there accumulation of assets that we wind up having, right? Do we have savings that are built up in our retirement nest egg or in our taxable brokerage account? They want to know, have you paid into the system, right? That's ultimately what it boils down to, okay? It's based upon these past wages and the time frame. Now, one thing that we will explore a little bit more, and this is about the Medicare program, is once you've been on SSDI for 24 months, you actually become eligible for Medicare. So some of you may have heard the term Medi-Medi. Well, what does that mean? That means that you're collecting and you have access to Medicare and, in the state of California, Medi-Cal as it pertains to your health insurance benefits. So commonly, people access Medicare because it's most commonly known as health insurance for retirees, right? So when you turn 65, that's when you have the option to transition into Medicare. Well, this is one of those, I don't want to call it an exception, but it's one of those alternate paths by which you get there. Being on SSDI for 24 months, then you become eligible for Medicare, right? So if we do have low income and if we are eligible for Medi-Cal, you may be able to participate in both. Think of it as a form of double coverage. Okay, so you can also receive SSDI and SSA if your wages are low. Now, Ken was showing what the maximum benefit amount could be for SSI. What we have to realize is that the SSDI income may offset some of that SSI capital that you could receive in addition to, but just know that you may be eligible for both. Okay. So as we keep exploring this eligibility for SSDI, okay, so let's take a look at this chart here. And really what this chart is designed to do is it's designed to say, okay, during these different phases, right? Young adults, okay, we're getting in, and by that I mean before 24, right? We're getting into our late 20s to early 30s, and then we get into our early 30s and beyond. Okay, so what the Social Security Administration is looking for is they're looking to see, okay, how many quarters roughly do you have, should you have been working in order to qualify? Now, again, this is not exact, but it's going to get you close enough. And the bottom line is, if you have a disability before age 24, okay, they're saying you need to have worked for at least a year and a half, okay, i.e. you need to have worked for 6 quarters, okay, earning that $1,700 per quarter amount. And that generally gets you to the threshold where you're able to participate, okay? If you're between 24 and 31, right, during this period, what they typically say is they want you to have worked for 3 years out of a roughly 6-year period, okay? So what does that mean? Well, 3 multiplied by 4 quarters per year, that means they want you working for about 12 quarters at that point in time. And then for those 31 and older, they're basically saying out of the last 10 years, they want you to have worked for at least 5 of those years. So 5 years multiplied by 4 quarters, that means they want you to have worked for about 20 quarters by the time you're roughly 31. Okay, so let's take that same information. I think let's look at it at a chart that's a little bit easier to digest. Okay, now there are some tiers and some levels beyond those first brackets that we just looked at. So for example, the older you become, okay, the more credits that the SSA is assuming that you have been working, okay? And so by the time you get to 62 plus, they're saying, okay, you needed about 10 credits, or sorry, 40 credits, 10 years of work. Okay, this is typically what makes you eligible for that Social Security retirement as well. They want to see that you've worked for 40 credits, but they realize that, hey, being able to fulfill your Social Security retirement benefits is not the same as disability. Disability in many cases will happen earlier. So what they've done is they've created this supplemental tiered system to account for the fact that you may not have worked as long, right, when you're becoming eligible for this bucket. So bottom line, under 24, you need to have worked for about a year and a half. 24 to 30, 31, it's somewhere between 2 and in this case to 4.5 years. 31 to 42, they want you working for about 5 years, and then it progressively goes up from there. Okay. So let's talk a little bit more about the acronym DAC, the Disabled Adult Child. Okay. It may also be called, right, the Childhood Disability Beneficiary, the CDB. Okay. So a lot of acronyms, a lot of lingo over here. But I think ultimately what we need to realize is an adult who has a disability that began before age 22 may be eligible for benefits if their parent is deceased or their parent starts receiving retirement or disability benefits. Okay. The SSA considers this a child benefit because it's paid on the parent's earnings record. Okay. So again, 2 triggers here. One trigger is parent passed away. Second trigger is parent is eligible to start collecting a benefit of their own, either a disability benefit or more commonly a retirement benefit. Okay. So children who are receiving benefits as a minor child on a parent's Social Security record may be eligible to continue receiving benefits on a parent's record upon reaching 18 if they have a qualifying disability. Okay. Where do we commonly see something like that happen? Well, if we go back to that OA, SDI, okay, the S, the survivor benefit. So how might a minor child be collecting money off of a parent before age 18? We commonly see it through a survivor benefit. Okay. So when the child is under the age of 16 and being cared for by their adult parent, they could be receiving a benefit in as much as the parent that's the caregiver. Okay. So when that child transitions over to age 18, right, assuming that they have and they meet the definition of the disability as well, they may very well continue to collect on a benefit from that parent's earning record. Okay. So again, this is just one of the transition points of, hey, might I keep something at an earlier age? And then as I continue to get older, right, at that 18, and then perhaps a little bit later than that, especially if the individual child has their own earnings and workings history. Okay. So the disabled adult child. So what is more of the formal definition that you might see? Well, it may be an adopted child, or in some cases, stepchild, grandchild, or a step grandchild in some cases. Now, they must be unmarried, okay, age 18 or older, and have a qualified disability that starts before 22. Now, we talked about that meeting the definition of disability for the adults. Remember that definition for an adult is different for a child. The definition of adult is they cannot do any substantial, gainful activity in terms of working. Okay, it's a very strict definition. Not the same as when they're younger than age 18. So, and it is not necessary, though, that the disabled adult child has ever worked. Okay, so even if your child has never had a part-time job or a full-time job in some cases, that's okay. A big part of what we see in this area is the disabled adult child participating and leveraging the parent's earning history. Okay, so we have to pay attention to one area though, and this is about earnings. Okay, so can a child collect SSDI and also work? Well, the answer is yes. Okay, however, what we need to be aware of is what's the limitation, because there is a ceiling, and that ceiling in 2024 means no more than $1,550 a month. Okay, now this is different, remember, than the work credit amount that we saw. The work credit was roughly $1,700 a quarter. If you're a disabled adult child, you can't make more than $1,050 per month. Okay, so a little bit different, month versus quarter. Now the amount is a little bit higher for those that are blind. It essentially adds another $1,000, so $2,590. So let's summarize this a little bit. Social Security for the individuals for an adult disabled child, disabled before 22. Okay, they're meeting the definition. They're eligible based upon their parents' work history. Now, how much might one expect to receive? Well, right here. While the parent is alive, they can expect to receive 50% of the parent's disability benefit amount. Now, in a moment, I'm going to show you what a Social Security sheet actually looks like and where we can identify that number. But just know that if the parent has passed, right, that child can actually receive up to 75% of their earnings record instead, right? So that benefit amount is a little bit higher if the parent has passed compared to if that parent is alive. Okay, so there is no resource test, but we do need to be mindful of the earnings, right? That $1,550 per month is what the disabled adult child can earn if they do have a part-time job. The Medicare after 24 months, right? They can also become eligible for Medi-Medi in some cases, but just know if you're on SSDI for 24 months, the trigger takes place where you could participate in Medicare. Remember, it's not just for individuals that are 65 and older. Folks can access this entitlement benefit earlier as well, okay? And then Social Security benefits may reduce or eliminate your SSI benefits, right? They can integrate, but we're not going to be able to max both of them out. Typically, there's going to be an offset that takes place. So with that being said, what are some of the frequent questions that Ken and I receive when we are meeting with families? This is one that comes up very commonly. What happens if my child is receiving SSDI and then gets married? Well, in many cases, the SSDI benefit goes away. However, there is an exception, and the exception is if the spouse is also a DAC and collecting SSDI benefits too, okay? So just know, if your child that is receiving Social Security disability benefits gets married to another individual that is not meeting the definition of disability and also collecting SSDI, then your child's benefit goes away. If their spouse is meeting that definition and is collecting SSDI on what would likely be their parents' entitlement and benefit, then they could both theoretically keep it. Okay? So, should I file for Social Security retirement benefits early so my child can become eligible for SSDI? We see this very commonly, and I know, Ken, you and I were talking about this a little bit before, but the answer is not always, yes, I want to start my own retirement benefit as an adult, so that way my child can reach SSDI, right? Where we see in practice, this comes a lot to the forecasting that Ken was mentioning, right? Sometimes delaying the Social Security retirement benefit as a parent, right, can actually be more beneficial for the family as a whole, right? Because it allows other resources, okay, to be drawn upon less over the life of the parent's retirement plan itself. Remember, Social Security retirement benefits is the only tool that lasts for your entire life, is backed by the full faith and credit of the government, and indexes with inflation every single year. Okay, delaying that benefit every year, especially once you reach 67 in many cases, is roughly an 8% increase. That's a big increased amount that you will have indefinitely. Okay, so in some cases, it may make sense to explore scenarios and numbers where delaying accepting a retirement benefit an extra 2, 3, 4 years could be more advantageous for the financial well-being of the entire family, instead of just having your child transition over to SSDI. Okay? So how can I find out how much the SSDI benefit will be for my child? Well, I'm going to jump ahead to the next slide really quickly. And what we're going to do is we're going to look at Wanda Worker. This is Wanda Worker's Social Security retirement page based upon 2023. Again, this is accessible through the Social Security Administration website. And what we're going to look at is we're going to look at a few quadrants here. This top right is talking about that Social Security retirement benefit. So Wanda Worker's full retirement is 67. And at 67, she's expected to get $2,119 per month, which continues to index with inflation every single year. However, when we're talking about SSDI, does my child receive this benefit of $2,119? The answer is no. We need to come over here to this disability benefit section. And in this disability benefit section, you'll see that Wanda Worker has paid credits and is now eligible for $2,083. without going into too much of the weeds, the calculation for a retirement benefit and a disability benefit is slightly different, okay? They look at your annual indexed monthly earnings, your AIM, and they have what are called these bend points. And because the bend points are different, the monthly benefit amounts are different. But this is what you would receive. So a DAC, right, they would receive 50% of this benefit if Wanda Worker was alive, and they could receive up to 75% of this benefit if Wanda Worker passed away. Now, again, one thing that we're not going to talk too much about is what is this total family benefits amount? Okay, there's a maximum amount that the Social Security Administration will provide to a family, as in they are not unlimited resources that they will just give. Okay, they'll provide to the individual that has their working history and is paid into the system. And then there are these auxiliary benefits that they could pay out to additional family members as well. So in Wanda Worker's case, her entire family could receive a maximum, of $3,802 per month. Okay. So taking one more step back as we go back to the FAQs, well, where do I go to learn more about SSDI, right? Well, the Social Security Administration website is a great place to start, right? We have a few PDFs that I know that we're going to provide to parents, helping parents to listen, that we can help post in the chat function today to help get you started and understand more about the benefits for your child, in as much as what does it take to start becoming eligible for SSI if you want to enroll in that service. But this is where speaking with other qualified professionals comes into play too, right? There are resources that we have access to that are available online and that you may have access to through other professionals as well. Okay. So I guess with that being said, Ken, do you have anything else that you would like to share as it pertains to SSI or SSDI? I know we covered a lot of information in a short period of time.
Yeah, so just to remember that if the child transitions from SSI to SSDI, we want to certainly try and get the dual eligibility on the healthcare, the Medi-Medi, the Medi-Cal and Medicare. Sometimes people say, well, gee, if there's not a resource limit for Medi-Cal here, and do we really need a special needs trust if they switch over to an entitlement program of SSDI? Well, you still may have to. You remember back when we talked about special needs trust, it's for not only to protect government benefits, but for also control. So it doesn't necessarily eliminate the need for a special needs trust. The other thing I wanted just to emphasize a little bit on the total family benefit. We have many families that have more than one disabled adult child, and we actually start running into limitations that the parent goes on Social Security, and then the child's they max out the family benefit of having 2 children. So it's important to realize what those limitations are, so that we can do the correct financial planning and of what those benefits are going to be for not only the parents, but also for the children.
Getting lots of thumbs up and applause. So thank you everybody for coming. We very much appreciate it. And we'll see you all next week. Thanks for staying a little bit extra too.